Chemotherapy is a type of cancer treatment that uses drugs to kill cancer cells. These drugs work by targeting cells that divide rapidly, which is a characteristic of cancer cells. Chemotherapy can be given alone or in combination with other treatments such as surgery or radiation therapy. Chemotherapy drugs can be administered in different ways, including orally, intravenously, or by injection. The specific drugs used in the method of administration will depend on the type and stage of cancer, as well as other factors such as the patient's overall health. Chemotherapy can have side effects, which may vary depending on the drugs used in the individual patient. Common side effects include nausea and vomiting, hair loss, fatigue, and decreased appetite. However, many of these side effects can be managed with medication or other supportive measures. It is important to note that while chemotherapy can be effective in treating cancer, it is not always a cure. The success of chemotherapy depends on various factors such as the type of cancer, the stage at which it is diagnosed, and the patient's overall health. Chemotherapy is a type of cancer treatment that uses drugs to kill cancer cells or stop them from growing and dividing. While chemotherapy can be very effective in treating cancer, it can also cause a range of side effects, including nausea and vomiting. Chemotherapy drugs can cause nausea and vomiting, which may last for several days after treatment. Hair loss. Chemotherapy can cause hair loss or thinning, which can affect the scalp, eyebrows, eyelashes, and other parts of the body. Fatigue. Chemotherapy can cause fatigue or tiredness, which may last for several weeks after treatment. Mouth sores. Chemotherapy can cause mouth sores or ulcers, which can make it difficult to eat, drink, or talk. Increased risk of infection. Chemotherapy can lower the number of white blood cells in the body, which can increase the risk of infection. Changes in taste and smell. Chemotherapy can affect the sense of taste and smell, making food taste different or unappealing. Skin changes. Chemotherapy can cause skin changes, such as dryness, rash, or sensitivity to sunlight. Nervous system changes. Chemotherapy can cause nervous system changes, such as numbness, tingling, or pain in the hands or feet. Constipation or diarrhea. Chemotherapy can cause constipation or diarrhea, which can be uncomfortable and disruptive. Fertility problems. Chemotherapy can affect fertility in both men and women, causing temporary or permanent infertility. It's important to note that not everyone will experience all of these side effects, and some people may not experience any side effects at all. If you are receiving chemotherapy, your healthcare provider can provide you with information on how to manage and minimize these side effects. Chemotherapy may be given in many ways. Some common ways include oral, comes in pills, capsules, or liquids that you swallow. Intravenous, IV, goes directly into a vein. Injection, given by a shot in a muscle in your arm, thigh, or hip, or right under the skin in the fatty part of your arm, leg, or belly. Intrathecal, injected into the space between the layers of tissue that cover the brain and spinal cord. Intraperitoneal, IP, goes directly into the peritoneal cavity, which is the area in your body that contains organs such as your intestines, stomach, and liver. Intraarterial, IA, injected directly into the artery that leads to the cancer. Topical, comes in a cream that you rub onto your skin. Chemotherapy drugs, which are typically used to treat cancer, can also be used to treat other conditions. Here are some additional examples. Bone marrow diseases. Diseases that affect the bone marrow and blood cells may be treated with a bone marrow transplant, also known as a stem cell transplant. Chemotherapy is often used to prepare for a bone marrow transplant. Immune system disorders. Lower doses of chemotherapy drugs can help control an overactive immune system in certain diseases, such as lupus and rheumatoid arthritis. Multiple sclerosis. Certain chemotherapy drugs, such as mitoxantrone, can be used to treat multiple sclerosis, MS, a chronic autoimmune disease that affects the central nervous system. Autoimmune hemolytic anemia, AIHA. AIHA is a rare autoimmune disorder in which the immune system attacks and destroys red blood cells. Chemotherapy drugs such as cyclophosphamide and vincristine can be used to suppress the immune system and reduce the destruction of red blood cells. Scleroderma. Scleroderma is a connective tissue disorder that causes hardening and thickening of the skin and internal organs. Systemic sclerosis. Systemic sclerosis is a chronic autoimmune disease that affects the skin and internal organs. Chemotherapy drugs such as cyclophosphamide and methotrexate can be used to suppress the immune system and slow the progression of the disease. It's important to note that the use of chemotherapy drugs for non-cancerous conditions is typically at lower doses than what is used for cancer treatment, and the treatment plan is tailored to the specific condition being treated. However, it's important to note that the use of chemotherapy for non-cancerous conditions is usually different than the treatment protocols used for cancer. The dosage, frequency, and duration of treatment may differ significantly depending on the specific condition being treated. As always, it's best to consult with a medical professional to determine the best treatment plan for your individual needs.